Good afternoon, and thank you for joining us once again. I'm joined today by Professor Jason Leitch, who will help me to answer questions. Before that, there are a few issues I want to update you on. I will, as usual, start with today's statistics. The total number of positive cases reported yesterday was 655. That represents 2.9% of the total number of tests and takes the total number of confirmed cases in Scotland to 212,509. 162 of those new cases were in Greater Glasgow and Clyde, 138 in Lothian, and 134 in Lanarkshire. The remaining cases were spread across 8 other health board areas. 397 people are currently in hospital, that is 8 fewer than yesterday, and 35 people are in intensive care, which is a reduction of 3 from yesterday. I'm very sorry, though, to report that 8 deaths were registered yesterday of patients who first tested positive over the previous 28 days. That takes the total number of deaths under this measurement to 7,554. And as always, we remember that behind those numbers are people whose loss will be sorely mourned by their loved ones, and I send them my heartfelt condolences. I can also provide an update on our latest vaccination figures. As of 7:30 this morning, 2,066,460 people in Scotland have received their first dose of the vaccine. That's an increase of 43,458 since yesterday. In addition, 9,335 people received their second dose yesterday, which brings the total number of second doses to 201,435. 97% of those aged 65 to 69 have now received their first dose, so have 80% of 60 to 64-year-olds, 46% of 50 to 59-year-olds, and 36% of 50 to 54-year-olds. As you know, supplies across the UK will be lower than expected in the coming month. Over that period, this means we will have in Scotland approximately 500,000 fewer doses than we had previously anticipated. And it means that there may be periods in April when we have to prioritise second doses. However, we do still expect to offer a first dose to JCVI groups 1 to 9, that's the highest priority groups, that's everyone over 50, all unpaid carers, all adults with particular underlying health conditions by the middle of April. And we still expect to have offered a first dose to all adults by the end of July. There are 3 other points I want to cover today. The first is about decommissioning the NHS Louisa Jordan. As you know, we established Louisa Jordan Hospital at the start of the pandemic as part of our COVID contingency planning to further support the NHS if we needed to. It has been operational for almost a year now. Because of the enormous effort of NHS staff across the country and your support, we've never had to use the Louisa Jordan for COVID patients, but it has played a vital part in the remobilisation of the NHS whilst the pandemic continued. And the rollout of the vaccination programme has also benefited from that service. In fact, by the end of this month, the hospital will have been used for more than 30,000 outpatient and diagnostic appointments. Nearly 7,000 healthcare staff and students will have received training at the facility, and around 175,000 people will have had their vaccinations there. Of course, we're now at a point where, largely thanks to the vaccination programme and your continued compliance with all the difficult restrictions we ask you to follow, our steady return to normality is in sight. And so it makes sense now for us to reallocate some of the hospital's resources to other parts of our NHS. This will also enable the SEC, where the hospital is located, to return to being a venue for conferences and events. So the NHS Louisa Jordan will close on Wednesday, the 31st of March. But the vaccination, which remains so critical to us, will relocate next door to SSE Hydro. So vaccination will still continue in that campus area. Some of the staff will continue to support the vaccination programme, others will return to their own health boards to support NHS remobilisation. The closure of NHS Louisa Jordan is, of course, a significant milestone. It has played a very valuable part in our response to the pandemic, and so I want to take this opportunity to thank all of those who helped construct it, establish the facility, currently work in the facility as support or healthcare staff or leaders, for very much indeed for all of their efforts. It was quite a remarkable achievement and continued until the end of this month to provide a very important service to our NHS. The vaccination will continue on that same area. My second update for today is about the return of hospital visiting. Since the pandemic began, visits to hospital wards have been suspended unless a patient is reaching the end of their life or in other exceptional circumstances. These restrictions have been unimaginably difficult for patients and for their loved ones, and imposing them has been one of the amongst many difficult decisions that we've had to take. But we also know it has been essential in protecting patients and staff and minimising the spread of the virus. Some restrictions on visiting will be essential for some time to come, and so we are providing extra funds to support virtual visiting, where patients keep in contact with their loved ones using a tablet or other device. And virtual visits have been used throughout the pandemic in circumstances where an in-person visit has still not been possible, and they've proved themselves to be a valuable alternative. But I know that many patients and loved ones are desperate to be able to see each other in person. So I'm pleased to confirm that, subject to the continued suppression of the virus, hospital visiting will restart from the 26th of April. Initially, only one visitor will be allowed for each patient, and we will be issuing guidance to our health boards to help them ensure that visits are safe as possible, and also to help ensure that patients and their loved ones understand what will be possible from the 26th of April and what we need them to do to help support that. The 26th of April will not be a return to normal visiting, but it is, I think, an important step towards normality and will, I hope, be welcomed by health staff, by patients and by their loved ones. My final update is about additional help which is being made available through GP practices. GPs are very often on the front line of finding out about the different types of help and advice that people need. But there are obviously limits to the assistance that GPs themselves can provide. So that's why we're providing additional funding to help GP practices provide a wider range of support. The funding will ensure that from September, dedicated advisors are embedded with 150 GP practices in our most deprived areas. The advisors will help people with issues like benefit eligibility, debt resolution, employability and housing. As a result, by picking up on patients' social and economic needs early, often that then show themselves through in health problems, and referring those individuals to trained advisors, this work will help to prevent people's problems from escalating further. And it will free up GPs to focus on the clinical care that they are best able to provide, enabling people to cope better with the challenges they've faced during this crisis, and bringing benefits to GP practices and to individuals in communities across the country. Those were the issues I wanted to cover today. As usual, I want to close by emphasising the need for all of us to continue to stick to the rules and the guidelines. Until April the 2nd, that means staying at home, except for essential purposes. Don't meet up with other households out indoors. And on occasion, when you do leave the house, remember facts. Wear face coverings when you're doing essential shopping, avoid anywhere that's busy, clean hands and hard surfaces, use 2-metre distancing, and self-isolate and book a test if you have symptoms. By sticking to these rules at the moment, we can make it safer for restrictions to be eased in the future. and we can keep the virus under control while vaccination continues. So please, for now, stay at home, protect the NHS and save lives. And my thanks once again to everyone who is doing that. Let's turn now to... No. Let's turn now to the journalists who've joined us today. And first of those is Ben Phillips from BBC Scotland.
Thank you very much, Health Secretary. We've been hearing from a number of dental experts who are warning of an oral health crisis with fewer people attending routine checkups. Now, we've spoken to one woman who struggled to get help during last year's lockdown, and she's since been diagnosed with jaw cancer. Some people say they've had a good service from their dentist since the services resumed last summer, but some others are saying that they haven't been able to get an appointment with an NHS dentist since then. Why is that, and how do we allow more people to be seen by their dentist quicker?
So I'm going to ask Jason to say a bit more about this, not least as qualified, more than qualified in this area. But let me say a couple of things before I hand over to Jason. NHS services in NHS contracted dentists should be as available now, the range of services as they were before the pandemic started. There are restrictions, though, on dentist practice, necessary restrictions to keep them and their staff and their patients safe. That includes PPE, it includes regular cleaning between patients, and it includes, obviously, physical distancing. That means that dentists see fewer patients in the normal working day. So that can cause some of these delays. But all of the NHS contracted services before the pandemic should now be available from an NHS dentist now, even before we're through the pandemic. Where there are specific instances where individuals are encountering difficulties, then I want them to let us know what those are. They can raise that with their local MSP, or they can get in touch with me so that we can then investigate those and try and resolve those particular issues for them. But Jason.
Finally, Ben, a question I have some expertise in, perhaps. So I think there's two elements to your question. The first is the importance of regular oral health review. So probably, arguably, it's the most important public health intervention that you normally do in your year, maybe along with the flu vaccine. But a regular attendance at the dentist allows a number of things to happen, not just for your conventional teeth and gum check, but also for an oral cancer check, like the story you just illustrated it with. It's the only place where that can really happen. It's one of the reasons why everybody should do it regularly, based on their disease. So the dentist and the dental team will give you advice about how often you should go. And you shouldn't let the pandemic stand in your way. So you should absolutely go. So the British Dental Association put out a press release yesterday, with which, in the main, I agree with, to advise the public to re-engage as much as possible with dentistry. The second part of your question is the bit that the Cabinet Secretary touched on, and that's our remobilisation of the service. That's not the patient's responsibility, that's our responsibility, along with the dental teams around the whole country. And the Chief Dental Officer has been working hard on that phased return to a new normal. That is difficult because of the nature of dentistry, lots of aerosol-generating procedures, lots of PPE, fallow time between cases. So it means that people will have to wait a bit longer than conventional, but the NHS dentists are open, they will see you, and you might have to wait just a little bit longer.
Thanks very much. Laura Alderman from STV.
Good afternoon and thank you. As you mentioned earlier, Health Secretary, the Louisa Jordan is going to close at the end of the month, and we also found out yesterday that that will come at a cost overall of £70 million. I just wanted to know, given that that has never treated a COVID patient, as you said, do you think that has been money well spent? And also, if it's going to be put back to its original purpose as a venue, should that give us any hope that there could be indoor mass events in the summer ahead?
So thank you very much, Laura. I do think it is money well spent. Remember when we commissioned the Louisa Jordan and how quickly it was constructed, with huge thanks to all of those who were involved in that. And we did that at a time when we were unsure enough about whether our existing NHS facilities, excellent though they are, would be able to cope with what we anticipated at that time would be the rising number of hospital cases and ICU need. So the NHS Louisa Jordan was commissioned as part of a really important piece of contingency planning. And it was always there and always ready to deal with COVID patients if that was needed. It is actually a point of thanks that we have never needed to use Louisa Jordan for that purpose. Now, that is down to the very hard work of our NHS staff across the country, but it's also down to all of you who are watching just now, and your family and your friends for complying so well with all the restrictions that we asked you to comply with, hard though that has been, because you helped to keep the virus lower than we feared it might get to. Now, that doesn't mean that the Louisa Jordan, as many of you will know, was sitting lying empty and unused. We used it, we used that facility to undertake outpatient work, diagnostic testing, other short-term procedures, whilst we are still dealing with the pandemic in order to try and minimise the impact on people's health to a degree of the health service being so focused on COVID care. That was really important. And I read the numbers out earlier about the number of people who've been helped. And in addition, it has provided a significant vaccination facility. That part of it we will retain. And we will retain that next door to the SEC and the Hydro. So a few short steps away, the Hydro will be providing that vaccination service. Meanwhile, the kit that is in the Louisa Jordan, all of the equipment, the machinery, the beds, all of that will be repurposed out so our NHS doesn't lose those. And the staff who work there, who have come from other health boards, will go back to those health boards to continue the remobilisation work. And some of them will move across a short distance to the Hydro to continue the vaccination programme. All of that makes perfect sense, I think, and people will understand that it was the right thing to do, the right thing to find really valuable use of it if we did not need it for COVID, though it was always ready to step up and be used if we ever did. And now to hand it back to the SEC, but continue vaccination on that site. I think that's right. On your point about handing it back to SEC, does that point to the possibility of that venue being used for events as we used to know them? Certainly COP26 is an important event on the horizon. There are other important events, I'm sure, but like everything else, steady, cautious progress led by the evidence takes us through what First Minister outlined this week. We know some particularly important dates coming up for us on the horizon, and as we work our way through those, as long as we continue to deliver the vaccination programme at pace, as supplies allow, all of us complying with the restrictions that apply at any given point, then we would hope to see significant progress over the summer and into the autumn and get us back to a place where, if we can see events again in places like the SEC. I don't know if Jason wants to add anything.
So briefly, I have absolutely no doubt that the contingency plan and building the Louisa Jordan was the right thing to do. You don't have to look very far. In fact, you only have to look to the rest of the UK, where the Nightingale hospitals did have to receive COVID patients. The Nightingale in London did require to ventilate people when intensive care in that region became overwhelmed. So we were close to that, but our intensive care units managed to do everybody inside their intensive care provision. But it was absolutely the right thing to do to have that on hand. It is now right to move on, although we should be very careful. Italy ran out of intensive care beds. Brazil has no intensive care capability today. In fact, people are dying because they can't get to intensive care. So this virus is still a problem, and still a problem in other parts of the world where intensive care is limited. So we are now at a stage, and I spent some of yesterday hearing from the West of Scotland intensive care leaders, in fact, debriefing on the second wave and how it has felt for them and how they have linked together and moved patients around. And it was very, very encouraging. They're tired, but it was very, very encouraging. So I think it's absolutely the right thing to do.
Thanks very much. James Matthews from Sky.
Thanks very much, Cabinet Secretary. A couple of questions, if I may. First of all, to the Clinical Director. Am I right in saying, Mr. Leitch, that there wasn't a significant rise in COVID cases as a result of the gathering of Rangers fans when they won the title? And I just wonder what that says about this weekend and how that might compromise the message surrounding gatherings. And Cabinet Secretary, can I ask you, should the First Minister resign after being found to have misled Parliament? And if she so instantly and quickly dismisses that finding by the Harassment Committee, what was the point of the inquiry in the first place?
Okay, thank you. James, I'll let Professor Leitch deal with your first question.
So you can't know for sure, James, and we've had this answer in a variety of forms for a variety of moments throughout this pandemic. You can't link solidly somebody's attendance at a pub, a restaurant, a home, and their positive test. You can if it's inside a workplace and there's a big outbreak, but it's very difficult because of the incubation period of the virus, to be sure. There is a time-related uptick in cases across the west of Scotland, kind of after that weekend. However, we can't know for sure that one led to the other because it seemed to happen quite quickly and then it went up a little bit and now it has stayed stable. I can tell you that some test and protect interviews with people who are positive suggest some of them were there. I know for certain that the science tells me if people gather, the virus can spread. So that gathering still worries me. I haven't seen, fortunately, a big uptick in cases. But our advice remains the same. Whoever you are, whichever mass gathering it is you wish to be in, you should not do it. And both of the clubs have been very, very clear this week, since we met with them last week, that the message is very straightforward. Stay at home.
Thanks very much. Jason, on your first point, James, I have to say before I say anything, this is a COVID briefing. That's what I'm here to answer questions on. Very briefly, on your first question, I do not believe the First Minister should resign. I do not believe she has misled Parliament, and I have absolute confidence in her veracity of what she said in those 8 hours of evidence to that committee, in her integrity and in her professionalism. And I am not going to comment on unattributed briefings about a report which has not yet been published. Peter Smith from ITV News.
Thank you very much, Cabinet Secretary. Just again, further to that point, the parliamentary inquiry, as James Matthews there has said, was set up to try and get to the bottom of this. And if you're already dismissing findings that we're hearing from this inquiry, and the Scottish Government has dismissed findings of it, saying that it's divided on party lines and it's partisan, then what faith, if we can't have faith in the parliamentary inquiry and our First Minister has misled Parliament, what faith can the people of Scotland have in our democratic institutions?
Well, Peter, let me repeat, this is a COVID briefing. I'm the Health Secretary. I'm not dismissing anything. What I am saying to you is the report has not yet been published, and I am not going to comment on unpublished reports or unattributed briefings on anything, actually. But what I'm here to do is talk to people who are watching, hopefully with COVID questions from you and your colleagues, about where we are in one of the most important things in their lives and mine, which is this pandemic and how we work our way through it. So that's what I'm going to do. And I'm now going to move on to Tom Eden from PA.
I would say that trust in our democratic institutions is extremely important. We have to have trust in the messaging we're getting from your government every day on this. And we're being told potentially that we have a First Minister who misled Parliament, a Parliament of the people.
And the key word there that you used was potentially. And we will know all of that when we see the report that is finally published, but most importantly, the independent report into whether or not the First Minister breached a ministerial code. Not yet published. Let's deal with those matters when they arise in the appropriate place, which frankly is not a COVID briefing. So I'm moving on now to Tom from PA.
Thank you, Health Secretary. and good afternoon to both. Firstly, to Jason Leitch, I was just wondering if there'll be any change in the actual number of vaccines that can be carried out at the hydro and the sort of total capacity as a result of the NHS Louisa Jordan's closure. And to you, Health Secretary, what is the contingency plan for who would lead the coronavirus response in the event that the First Minister does resign? I appreciate it's entirely hypothetical at this stage, and you said you don't think she should resign, but given the importance of continuity during this public health emergency, what would happen in the aftermath if she did?
So let me deal with both of your questions, Tom. We have a Deputy First Minister, but I have no expectation at all that our current most excellent First Minister will resign. On your point about vaccinations at the hydro, the volume of capacity will not be reduced in any respect, so the hydro will still be able to do up to 10,000 vaccinations a day, but it is dependent on supply, and it is also has to recognise that as well as something like the hydro that can do a large number, we also have lots of smaller sites which are often more appropriate for individuals because they're closer to where they live, and therefore they don't need to take a number of buses to get there. So our delivery infrastructure is a bit of a mix between those large sites like the hydro. Here in Edinburgh, we have the EICC, we have a drive-through site at Queen Margaret's, we have a large site up in Aberdeen, but we also have lots of smaller sites deliberately so that people can access the vaccine as easily as we can make it, while still trying to get through as large a number of people as supplies allow us to get through. Tom Martin from the Daily Express.
Hi, thank you, Cabinet Secretary. If I could just return to this issue of public trust. This is vital during the pandemic. People are watching and listening to these messages. How can they have faith in the messaging coming out given the events of the last 24 hours? Is it not the case the First Minister has now damaged goods in delivering this message?
No, it's not the case. And the public continue. I am so grateful for this. All of the people watching, all of the people listening to the many briefings that the First Minister or I or Professor Leitch give, I am so grateful to them for paying attention and trusting us with their compliance with those restrictions, because they can see the difference it makes. They can see the rationale for why we do that. They can, if they want, go on to Public Health Scotland websites, Scottish Government website, NHS Inform website, and look at the data and the information for themselves. That's what counts, and what counts a great deal is from the outset we have been really clear that we will be as open and transparent about this virus and how we're addressing it as we possibly can be, increasingly publishing more information. And we will deal with the public of Scotland as the adults that they are. We continue to do that, and I am very, very grateful to them indeed for their continued trust in what we are saying and their continued compliance and what we are asking them to do. Georgina Hayes from The Telegraph.
Good afternoon to you both. This is a question that might be more for Professor Leitch, but I definitely welcome the Cabinet Secretary's input. Potentially vaccine-resistant variants of the virus remain obviously a huge concern, and I think a lot of people might be wondering what we can expect if one does establish itself in Scotland. We know that the vaccines can be updated, but could a dangerous variant establishing itself mean that there's another sort of sense of weeks or months of another lockdown while the new jab is rolled out?
Thanks very much, Georgina. I know it's a question that many people have in their own minds. So let's go first to Professor Leitch.
So the principal challenge here, Georgina, is that mutations are more likely in high prevalence areas. So if you have more opportunities for the virus to move, it has more random opportunities to mutate. That random mutation is one of the ways it might gain an advantage. That's what happened in Kent. It's what happened in South Africa. It's what happened in Brazil, where we first found those mutations. So the principal thing everybody can do, you, me, and everybody else, is get the incidence down. That makes mutations much less likely. The second thing we can do is stop them coming from other places, because in high prevalence areas, more likely to mutate, and therefore to bring them in, one that we would not be used to having. Now, we have ways of doing that with genomic testing, with contact tracing, with enhanced contact tracing for some of the variants of concern, but we also have to think about border control, and you've heard from this podium for weeks now about how we're trying to make that as tight as we can, and that will have to carry on. I've just illustrated that with some stories from other countries. If you just look at France today, France is about to go in to another lockdown, including their major cities, including their hospitality industry, because their incidence is too high. That's where mutations will happen, and that's what we have to stop importing. I cannot rule out the fact that another mutation could arrive in Scotland and it could escape the vaccine. That's unlikely to happen in one step. What tends to happen is the virus mutates in steps, in moments, and eventually one would need a different vaccine. And the vaccine scientists are very capable of changing the vaccine in a way that will protect us. And that may be a booster set of doses in the autumn or the winter.
Thanks very much, Jason. Let me add a couple of points. Georgina, Jason mentioned there the importance of genomic testing, genomic sequencing, and it's worth remembering that this week the First Minister announced a £13 million investment to further increase the capacity here in Scotland for genomic sequencing. That's important right now for this virus, but it is also an investment in the long-term public health infrastructure for Scotland. So we're paying close attention to this and close attention to where we sensibly put our investment in order to respond to this pandemic and what the virus might do, but also for the future. And the final point I'd make was, again this week, the First Minister and I had one of our now fairly regular calls with Pfizer and with Oxford AstraZeneca to discuss a number of issues with them. And I know from those discussions that they, with their scientists and their researchers, linked in elsewhere and around the world and with our health service, are looking very closely at anything that might emerge and what that might mean for the properties of the vaccine that they're currently producing. So it's not new for vaccine manufacturers to constantly be reviewing whether the properties need to change in any way at all, but I hope it is reassuring to people watching that this is actively and consistently looked at, and there are a number of ways, as Jason has outlined, by which we make sure that we are staying on top of the situation. Mark McLaughlin from The Times.
Good afternoon. A couple of points, probably one for Jason. Looking at the NRS stats from Wednesday, the deaths in over 80s plateaued. If you plot it on a graph, it drops like a stone from January and then almost hits a shelf. Can you explain why that seems to have happened? Is this, people who are still susceptible, the small number that the vaccine won't help? Another thing I wanted to ask about was Devi Sridhar in a podcast said that the plan is to vaccinate children from autumn and will still be under very, very strict travel restrictions. Is that the plan? And another question, if I may, is related. I know that the hospital cases fell below 400 today. During the first wave, when they fell below 400, the pubs reopened a week later. So why are we having to wait another month for the pubs to reopen if we were able to achieve zero COVID over the summer when pubs reopened much earlier?
Thanks very much, Mark. I am going to go mostly to Jason to answer most of those questions that you've asked. Quite rightly, you knew it was him who would be best placed to answer them. The only point I'd make is really on your last question. I know Jason will say more about this, but we need to be careful about single day data or even two or 3 days data. We know this. We know that you need to look at whether or not any reductions are sustained over time in order to give yourself confidence that you can ease any more restrictions, recognising that every time you ease a restriction, then cases will rise. Now, will they rise by a little or will they rise by a lot? And again, that is the constant monitoring. I know you're probably watching this getting fed up hearing with me saying this, but it is true that every single day people like Jason and others in government and in the health service and in Public Health Scotland, the First Minister and I are looking every day at what is the data telling us and how is it tracking over time. But otherwise, Jason.
So 3 questions in there, Mark. Let me try and deal with them as quickly as I can. The over 80s, now we should first of all start by saying every single death is a tragedy, and I don't say that glibly at all. Every family who's having to mourn the nearly 10,000 deaths in Scotland now related to COVID-19 is horrific. I would be speculating if I gave you definitive answers to why that has plateaued. I imagine part of it is you're right. It's quite low numbers. The vaccine is not foolproof. Nobody ever said it was. And the vaccine is not appropriate for everybody. So end-of-life care patients, for instance, you wouldn't probably give them the vaccine. So it may be just the tail of some of that. And we will continue to look at it. We continue to hope it will fall. It does illustrate the fact that young people still have a responsibility to stop themselves, to make sure they follow the guidance in order for elderly people not to still catch the virus, because the vaccine is not 100% foolproof. There is no science yet about children's vaccines. I would hope that we will be able to move into vaccinating children sometime this year. That's what the vaccine scientists are aiming for. We're doing trials in children. We're doing trials in pregnant women. They've even started to vaccinate some infants in some of those trials. It's all going well. The safety of this vaccine in adults is so good that that has allowed the regulators to allow them to start to test them in children. I expect us to vaccinate children in the world this year, but I can't tell you for sure when that'll be and who will go first, but I would imagine we'd be near the front of that queue. And the reason this exit from lockdown is different from the last exit from lockdown is twofold. One, we've learned things, because look what happened when we opened the last time. And two, we have a new variant. We have a completely different virus that transmits at 50 to 70% more efficacy, and therefore you're more likely to get it in pubs, in houses, everywhere. So therefore, this exit has to be done very, very cautiously. I actually think we're going relatively quickly, but we need 3-week blocks so we can decide if we can move to the next stage.
Thanks very much. Thanks, Jason. Michael Blackley from the Daily Mail.
Hello, good afternoon. Just to pick up on the previous question, I think Mark had asked about travel as well. The aviation leaders were told by Scottish Government officials earlier this week that it may be that there's restrictions in place on international travel for the whole of this year. Is it simply the case? Should people be aware now that foreign holidays are off for the whole of this year unless they are prepared to enter a quarantine hotel for 10 days when they return? And also, if I could just briefly ask as well, just on the vaccine supply issues, when should most people aged 40 to 49 expect to start receiving the first dose?
Excuse me. So, excuse me. Just on your last point about vaccine supply. So we've said, I said earlier, we've said it before, that notwithstanding the current dip in the number of doses we expected, we still believe that we can, with careful modelling, a lot of work going on to ensure this can happen, but we still believe that we will meet our commitment to offer the first dose of the vaccine to those JCVI priority groups 1 to 9, that's everyone over 50, as I outlined earlier, and to be able to do that by the middle of April. So as we approach that point, we then are increasingly confident about future supplies. We know about supplies a little in advance. The numbers do change, though, as we've just seen, as evident by why you're asking me this question. So as we approach that, we then start to issue the appointment letters to people who are in the 40 to 49 group. And then as we work our way through them, we don't wait for that to finish. As we work our way through them, again, looking ahead at what we expect to come in, we then go to the 30 to 39 age group and so on all the way through. taking us to that point which we've said, which is that we remain confident that, supplies permitting, we'll have vaccinated all of the 4.45 adults eligible by the end of July. So that's how it works. As we work through the coming weeks, though, we will continue to ensure that the public in Scotland are aware of our progress, aware of how we're doing in meeting those timelines I've set out, and that when we are ready to issue the appointment letters and schedule in those who are 40 to 49, then again, we'll make that known too. Different boards may move at slightly different paces. It won't be significant between boards, and it is entirely determined by the size of their population in any one of those age cohorts, or in the other cohorts like adults with underlying health conditions or unpaid carers. And of course, there is the portal for unpaid carers to register themselves so that we can make sure we don't miss any of those individuals either. On your point about aviation, I'm going to ask Jason to talk a little bit more about what underlies the overall position on that. But the overall position on that at this point is, as the First Minister has said, we do not know, and we cannot be confident in knowing at this point when we will be able to make detailed further easings. And that, of course, includes holidays. And that I completely understand that that is not what the aviation industry ideally would want to hear. But let's go back to what Jason said just a minute ago. A different virus, much more infectious, and lessons learned from the last time we came out of the lockdown situation, and the importance of the 3-week block between decisions. So that's why the First Minister, in what she set out on Tuesday, set out quite a lot of detail about the 2nd of April, the 5th of April, the end of April, what we thought might be possible in May, but didn't really go that much further, because to go that much further is really to say something for the sake of saying it, as opposed to being confident in the progress that we're making. And as we go through those steps, then we will make those further announcements, as long as we are continuing to make progress in suppressing the virus and vaccinating the population. And we will make sure that the public across Scotland are kept well aware of the decisions we're taking, but also the rationale and the evidence that underpins those decisions and judgments that we make. Jason.
It's a little bit obvious, Michael, my extra point, and that is that global travel requires 2 destinations. You've got to be able to go to the place. So just now, if you want to go on holiday to New Zealand, you can't. New Zealand won't let UK people in. If you want to go to France tomorrow, you probably won't be able to, because France is locking down. So global travel will not be normal for a long time. Scotland will have to take a view, along with the whole of the UK, about what our contribution is to the safety of global travel. And I think that will change over time, just like it has over the last year. I can imagine a world in which travel corridors may come back from low prevalence areas to low prevalence areas. But let's be clear, we're not a low prevalence area just now. I hope we will be, and then global travel, safely controlled with testing, perhaps some isolation, will be absolutely necessary for some time to come.
Thanks very much. Conor Marlborough from The Scotsman.
Hi there, good afternoon. I have 2 questions very quickly. Age Scotland have called for an inquiry to be held after they were contacted by people who are broadly healthy but aged over 60, who were contacted about having to sign DNR statements. And so I'd like to know whether the Health Secretary, whether you agree there should be an inquiry, and quickly to Professor Leitch, whether he can imagine what kind of clinical reason there might be for people who are healthy to be contacted about that kind of thing. And then very quickly, if I can, just to pick up on something you said, Professor Leitch, about Scotland coming quite close to requiring the use of NHS Louisa Jordan for COVID patients. Exactly how close did we come to needing it? Was it a few dozen patients or more than that? Thanks.
Thanks very much, Conor. Just on the DNR and Age Scotland question, and I know Jason will want to say a bit more about that as you have asked. There has been absolutely no change at any point throughout this pandemic on the expectation of government and of the NHS Scotland on how discussions are undertaken between clinicians, patients and families that may or may not lead to a DNR notice. No change whatsoever. Now, I'm concerned about what Age Scotland are reported to be saying, and I would want to meet them and talk to them and understand what their evidence is for that. I'm not dismissing it, I just need to understand it and know it, so that if there have been any instances where it is evident that the clear clinically led process, but with a very strong patient focus, is being stepped outside of for whatever reason, then we will want to look at that and see if there is anything more that we should be asking our senior clinicians to do, not least our Chief Medical Officer, to advise people who have that difficult responsibility sometimes to have those conversations with patients and families. But I want to be really clear. The whole side of do not resuscitate notices and discussions is clinically led. It's not led by politicians, nor should it ever be. But there has been no change in the approach pre-pandemic or throughout the pandemic. Jason.
I would just say the same thing. There is no blanket guidance which sets an age-related limit, a disease-related limit, a gender-related limit to whether you are considered within that do not resuscitate group. All the conversations should be person-centred with the individual and with the family if that's appropriate, and anybody who cares for that individual. I'd be very disturbed if healthy over 60-year-olds are being asked to sign do not resuscitate orders. I don't believe that to be true. There will be conversations that are challenging. I've had those conversations with families. They're often very difficult, very emotional, but they usually reach a conclusion that everybody in the room is comfortable with. And that's what most clinicians would endeavour to do in that environment. To your second point, the intensive care units over Scotland did a fantastic job during both of these waves. They managed within their existing resource. Now, let's remember what that meant, though. That meant moving intensive care units into operating theatres. It meant taking staff from other parts of the National Health Service and making them into intensive care units. So we had to move beyond our existing capacity. The next level up would have been move more of our existing capacity into those hospitals, and then the next level up would have been the Louisa Jordan, which fortunately we didn't require.
Thanks very much. David Ball from the Herald.
Thank you, Cabinet Secretary. On hospital visiting, I missed this in your opening remarks, but do we know how much funding will be used for the digital or virtual visiting? And from a clinical point of view, is that an adequate substitution for in-person visiting, particularly for vulnerable patients? And secondly, if we do see more crowds gathering and breaking health rules at the Celtic Rangers game on Sunday, would this be the end of football being allowed to continue during the pandemic? And what justification would there be for allowing sport to continue to get sort of special treatment to continue?
Okay, thanks very much, David. Support for virtual visiting has been available for much of the pandemic. Of course, it's no substitute for person-to-person visiting, which is precisely why at the start of this briefing, I announced when that would then become possible, albeit in a limited way, but nonetheless a really important step forward. I know from some of the feedback that I received, but also some of the feedback that comes to me from others, that patients and families have valued that in a period of lockdown, there has been the opportunity to have virtual visiting using devices that are provided, but different platforms to do that. it is no substitute for person-to-person visiting. Any one of us who knows that in the recent period and even before that, we were in touch with our families, often not living very far away, but within the restrictions, not possible to see them in any person-to-person way, that no matter how good the platform, it is no substitute. And that's why we're all longing for that opportunity that will come shortly, when we will be able to see family and friends individually in person, albeit outside 2 meters distancing, but nonetheless in person. So the step that I've announced today to go one step on now with hospital visiting, in-person visiting, one visitor, and all the guidance we'll then produce from that date towards the end of April is really, really important. Jason may want to say a bit about sport and elite sport. Let me just say that the discussions on the Rangers-Celtic game following on from the previous or the weekend where there was real concern about public order and public safety with the clubs and with the other authorities and with my colleague, Mr. Youssef, is ongoing, and I would hope that we would see a statement on that later today. Anything on sport, Jason?
Yeah, briefly, I would be very disappointed if fans chose to gather at the weekend at the Old Firm game, but I'd be equally disappointed if any mass gatherings happened. We've been very clear to both of the clubs this week and last weekend about the messaging. That messaging has got over from captains and from managers, and we're very grateful for their involvement with all of their fan clubs and their broader fan base. So they really, really have to stay at home.
Thanks very much. And our final journalist today is Abby Garton from The Sun.
Good afternoon, Cabinet Secretary. I was wanting to follow on from to ask you about the Celtic Rangers game that we think should be going ahead on Saturday. So firstly, Health Secretary, do you have a message to supporters ahead of the match? And this is quite similar to what was asked before, but what kind of ramifications could supporters and, the football teams and everything face if they don't stick to the rules on Sunday? Thank you.
I have a really clear message for football fans, regardless of which team they support, and for all of us, and that is the current requirement is that we stay at home. And that's not because we don't want people to enjoy themselves or support their football teams or any of their sports. It's because right now that really matters. It matters in order to suppress the virus. And importantly, as Jason said earlier to another question, every time the virus can transmit itself from one person to another, we give it the opportunity to mutate. And we've discussed mutations and the difficulties that they might pose us here today and in previous occasions. So my message to all of us, every single one of us, is until the guidance changes, right now, stay home. Find other ways to celebrate. A week ago, I asked women who were angry, distressed, upset, and rightly so, about the lives they have to live, we have to live, in order to protect ourselves from violence, to not gather, to show their respect for a woman who died south of the border and for all of those who've been injured and hurt and have to live in the spectre of violence. I asked them not to do that. And I said, if it was different, I would be with you. They heeded that ask, and I am so grateful to them for doing it. And when it is possible for us to gather again as women and express our opinions strongly and clearly, then I will be with you to do that. So my ask now of football fans and everyone else is exactly what I asked those women to do a week ago. Stay at home. Find other ways to support your team, to celebrate. There are many digital ways to do that. And when the time comes, then you'll be able safely to gather and celebrate and support your team. But right now, the more we stay at home, the more likely that time of gathering is to happen. If we don't do that, we push that time further away. Jason?
No, I think that's it.
Okay, that's us for today. My thanks indeed to the journalists for joining us, to Rachel, who's been our BSL interpreter again today, to Jason for joining me, but most of all to all of you for the time you've given us yet again. The next COVID update will be the First Minister's statement in Parliament on Tuesday, where we will also commemorate the lives that we have lost and the sacrifice and solidarity shown throughout the last year as we mark 12 months since lockdown. After that, we will then be in the election period, so COVID briefings will only take place when there are announcements to make or changes to public health information that we need to share with you. Meantime, until the 2nd of April, please stay at home, except for essential purposes. Don't meet up with other households indoors, and on any occasion when you do leave home, please remember facts. Wear face coverings when doing essential shopping, avoid anywhere that is busy, clean hands and hard surfaces, use 2-metre distancing, and self-isolate and book a test if you have symptoms. By sticking to these rules at the moment, we bring the days when we have fewer rules to stick to closer. So right now, please stay at home, protect the NHS, save lives, and in a day where the sun, I think, is shining across most of Scotland, I hope that you'll be able to go outside for some of that exercise that will make all of us feel better, and that you have as enjoyable a weekend as is possible. Thank you very much.